we have observed one prospective study that has been conducted, I think, in the nurses' health study, that also they demonstrate in case of dry beans that increases the risk of stroke. And also in the Predimed study, also we have analyzed the association, and in this case also we have observed an increasing risk of stroke. But this was not published. You have published the results, but nothing is in the discussion of the article. So I don't know, it's possible that in this case, dry beans are consumed, I don't know, with another dish, another type of dish. We have adjusted for meat and for processed meat, because in case of, in Spain, it's very usual that dry beans are consumed with this type of food, but also adjusting for this, we have observed an increase in stroke. What is the mechanism? I think it's important to report negative results, and this is, now this article is sent to a journal, but it is difficult to have a positive response with unexpected results. If you publish unexpected results, it's very difficult to be published in some cases.
Yeah, maybe I'll just comment on that. You're right about the finding we had. We didn't say much about it because we didn't have too much to say about it. But I think your earlier point is true, that in our data, in our population, the consumption of legumes and beans in particular is very low. And so I didn't put much confidence in that particular finding. We thought it might be just due to chance, but if you're seeing the same thing, it obviously deserves some further examination. One interesting finding we've had for a number of outcomes is that peas, which would be fresh peas or frozen, not dried peas, almost entirely fresh, which are commonly consumed, related to more weight gain, other negative health outcomes, actually. And I don't know how, I haven't looked carefully with the glycemic index, but they're clearly mostly starch, and they travel along like with corn, which also is a vegetable, doesn't seem to have beneficial outcomes. So I don't know if other people have looked at fresh pea consumption. I haven't carefully looked at that. Maybe David has, but including them with vegetables doesn't seem to be a great thing to be doing. Interestingly, they're usually included as vegetables because they're not dry. They're not included with legumes in a lot of analyses.
For Dr. Willett, the pure study is clearly very important on a global scale. However, about 92% of the cohort comes from low-income countries, where a diet rich in refined carbohydrates may simply be an indicator of a poor diet. So I wonder how much these results can apply to other areas of the world. For Jordi and Monica, we already discussed last night, but the issue of legumes is that they are not only carbohydrates, they include proteins, they include fats, and so equating legumes to carbohydrates is not obvious. Thanks.
No, I quite agree. On the comments related to pure study, part of the problem was the interpretation and the representation of the results is, I hate to say it, by both the investigators, but even more so by the press, as, oh, this overturns dietary advice just broadly without any qualification. It was just completely inappropriate. You definitely can have too much carbohydrate, I think, when you're up at 60, 70%. Even if it's whole grain, you're going to be displacing a lot of other things in the diet. But to generalize these, in particular, given the weakness, in addition, given the weakness of the study, that was a one-time measurement in the rapidly changing context. But it was, I think, the misinterpretation and overgeneralization which were the biggest problems there, I think, as Carlos was pointed out.
Fred, in the case of the second question, yes, we agree. At the end, it's a food matrix that is that is the,
That's great.
yes. Okay.
Yeah, I'm Fred Browns, Maastricht University. I have a question to Walter and maybe also to the others. Walter, you showed that high starch in one study had resulted in higher diabetes risk in women. And you addressed carbohydrate quality, and then within your listing of carbohydrate quality, you also had the word fructose. Shouldn't we, and that's a feeling I have, put more emphasis on the fact that the quality of a certain carbohydrate in itself is not very meaningful, but it becomes meaningful in the context of diet quality or food quality? And let me give two examples. If you look at fructose, there are many studies that say fructose is a bad carbohydrate. But fructose, as we consume it, along with glucose, in most cases, for example, sucrose, the metabolism is totally different than fructose itself. Moreover, if we put fructose in a certain food matrix, being a sugar-sweetened beverage, or a solid food, then the metabolic effects of the two are also different. So the quality of the carbohydrate depends very much on the matrix. If you look to starch, there are two populations that have a very low income. The Okinawa in Japan, they consume roughly 65% energy of carbohydrate. Most of it is from sweet potato, which is a starch. There's another population in South America, that is the Tsunami population. They consume 70% carbohydrate. Yet these two populations have the lowest incidence worldwide of cardiovascular disease, diabetes, etc. And that tells me that the carbohydrate quality in this case, the starch, depends totally on the overall diet quality. And I think this gets lost in many, especially social media platforms, where carbohydrates are doomed to be very, very bad, and where we have now a trend to go for low carb and high fat diets instead. So I would like to know what you feel about carbohydrate quality in isolation, just as GI in isolation, what does it mean? But it becomes meaningful in the context of the whole diet.
Yeah, well, I certainly agree with the comment that was already reinforced, that the one factor in isolation is hard to interpret. And I put fructose on the list because there are some people who believe that this is the whole answer. I won't name any names, but and getting a lot of press about it. And I think it's clearly not correct. But many of these factors may contribute independently and either synergistically or additively to come up to, in the end, be the whole diet. So that is one of the complexities that we do find. But also I would be cautious about these comparisons of different populations because, again, in an even bigger picture, the effects of diet depend on the whole lifestyle too, and in particular the level of physical activity and smoking and other behaviors like that. So the cross-country comparisons I think are like the least helpful. But still, there is this tension between reductionist perspective and looking at the whole picture. And I think we have the best understanding when we look at issues both with a reductionist approach and looking at the whole picture, that one way or the other doesn't lead to the deepest understanding. That I think I think we would all agree that the effect of carbohydrate from any particular source, and I do think it's helpful, more or less as it's been suggested, looking at, say, carbohydrate from food is a very helpful way of looking at it. That's why we created these variables. It took a lot of trouble and dietitian time to do that. Carbohydrates from grains, or carbohydrates from whole grains, or refined grains from potatoes, that you are representing the matrix by doing it that way. But yeah, it still is also helpful to, on a reductionist standpoint, to look at glycemic index, which is a simplistic variable. It doesn't explain everything, but it does. One example that was informative to me was we were doing a study and wanted to use a really good quality carbohydrate, and I thought, in the form of rice, that the best would be whole grain brown rice parboiled, because the parboiling also tends to reduce the glycemic index. So we wanted a very standardized source, and so Uncle Ben's has a product, parboiled brown rice. And just to check, it should have been really low GI, but just before doing the study, we did had a group do the glycemic index evaluation, and it was super high. And I was shocked by that, because it should have been a really healthy product. But I talked to Uncle Ben's people, and they said it was a special strain of high amylopectin starch that helped reduce the cooking time. So there is some value in this sort of reductionist approach, single variable, but looking at it in the context of the big picture as well. So there is this tension, and I think that's something that faces us as we talk about how do we characterize carbohydrate quality. It really does make a difference. Multiple factors do, and it's a little bit like the old story, the Indian blind men palpating an elephant, and each one feeling a different part and describing it very differently. And I think the point is, if you got all those men together afterwards and had them talk to each other, then you'd really have the best understanding of the elephant. That each one of the ways gives us an incomplete picture.
My question is for Monica. Can you tell me a bit more about what whole grains are in a Mediterranean diet? Because just as a tourist in Mediterranean countries, I see white pasta, not brown pasta, and I see white bread, not whole grain bread. So where are the whole grains in a Mediterranean diet?
Yeah, you are right. So even in Spain, the Mediterranean diet has dropped a lot. So, but now we are trying to recover the situation in the ranking, you know. So whole grains are basically, at the moment, I'm not wrong, whole grains are basically as a cereal breakfast. We have some whole bread in the market. So every time you have more whole bread, it was not in the past, it was all bread and pasta was refined. And we are starting to use even whole pasta, whole grain pasta. So this is what I mean when I say whole grain. But if you remember when I show you the relative contribution of different type of food, whole grain bread was almost contributing, I think it was in 6.8%. So it was not a huge contribution. The huge contribution in cereals was refined pasta and also white bread. It was in the slide, if you remember. But yeah, the intake of whole grain cereals is increasing. Yeah.
Just another comment too, following on from what Walt said about the parboiled rice. My understanding is parboiling doesn't in itself affect the GI. It's what grain you start with, or what rice you start with. You will have the same GI for the parboiled version of that. So it's not parboiling that's doing the trick. And with respect to pasta, what we found was when a well-known pasta company tried to produce a palatable whole grain pasta, actually, in the process, they actually increased the GI compared to the white pasta. So we need to be aware that in our efforts to make whole grains palatable to the average person, that in the process we're probably taking away a lot of the things that are effective in terms of improving risk factors and outcomes.
Yeah, good point. I think it is, I think, a good example of why we do need to look at what we're doing with different lenses. It's definitely good to have whole grains, but at the same time, it's helpful to look at the glycemic index as well.
I have a question to Jordi. You were presenting data from the Pew study that the benefit for legumes started at about 1 serving per day. And you also showed a meta-analysis from Lucas Wincarthel, where you then said that really the overall intake in these randomized controlled trials was really low. So even in randomized controlled trials, we can't get people to eat large amount of legumes. That's the take-home message, at least for me. So how do we get people to consume more legumes if all the other data show it's so very low? Do we have to rethink and draw up new foods that contain lentils and things like that in their composition?
Legumes is one of the traditional food from the Mediterranean countries in general. So it has, this has been decreased, the consumption has been decreased in the last years, but we try to, the dietitians when they come, the patient come in order to be advised in order to increase these adherence to the Mediterranean diet, they try to increase this consumption. So, because there are several dishes in Mediterranean countries that are typical, made by lentils and chickpeas especially, and beans, etc. So, is that?
Well, I'm thinking that we know that personal advice is one pillar, of course, but it's already late when they come to see you, and that availability of food that contains a legume should increase in general, so people do grow up in an environment where it's available. And do we have to think new ways there?
I think what you described is a huge challenge broadly about how do we improve diets. And legumes seem to be one area that's more challenging than others, but David Jenkins and I have had quite a bit of conversation about this. And when you especially try to do it in the context of a trial and in a free-living population, the results can be very disappointing. But I think some of this is, it really involves long-term cultural change. And if we looked at tobacco, for example, which is highly addictive, the studies that tried to get people to stop smoking at 1 year with intensive treatment, drugs, psychotherapy, have about a 10% success rate. I would say horrible. But yet if we look over a 40-year period, in men in the United States, the prevalence of use has gone down from about 60% to less than 20%. So it's taken 4 or 5 decades to accomplish that. And I think diet is going to be something like that, that to see rapid changes, we'll be disappointed. But we do see big changes in diet. That figure I showed, if we look over a 12-year period, yeah, something's changed. Soda decreased 25%. That's you know, people argue is that addictive or not, but it's something a lot of people have trouble giving up. But part of it is having the change be socially desirable. And a lot of times with legumes, that was a food of poverty. And then the stigma becomes attached to that. And desirability is attached to red meat and processed foods. So that's one thing we're working against. And a lot of our efforts to change diet have been in collaboration with the Culinary Institute of America, having, including increasing the uptake of Mediterranean diet. And we've been working on that for almost 20 years now. And it's really been successful. You ask almost everyone what's the most desirable diet in the United States. Overwhelmingly, people would say Mediterranean diet. But it took a lot of effort working with the culinary people, bringing in food writers. So it's having attractive, good, delicious versions of it, giving it appeal, prestige. All of those things are part of the cultural change of modifying eating norms. And weaving some legumes into that is an important part of it. But there's no, I think this is a slow change process, but in epidemiology and public health, we're sort of used to that. And if you're patients, things do change.
what
I
we
can just
have-
reinforce what Walt said, since he raised the discussion that, as we said, we've been having for a very long time. I think Sarah's here from old ways, and I think you don't have to have new ways necessarily. You can go back to old ways. And I think that we've got so much of a cornucopia of old ways of eating legumes. I mean, a mess of pottage was in the Bible, which was apparently a lentil soup. One gave up one's inheritance for that in the old days. So I don't think the old ways have been exploited enough, and I think, as Walter is saying, attractive ways of bringing old ways back into the new way are probably an important way of going forward over time.
Only to add that in case of our clinical trial, in case of Predimed, this is one of the items that we have changed, or the dietitians have changed, and we have observed an increase in the consumption of legumes. So this is possible, okay? And also I would like to say that what we have observed, this association, we have observed using the baseline consumption of the population, that is the usual consumption of the population, but also the cumulative consumption during the follow-up. So I think, and we have observed in both conditions, we have observed the same associations.
Okay, I think we should end our discussion for the moment. It's time for a coffee break, which is being served just outside. So we'll take a 15-minute coffee break and we'll continue this important session. Thank you.